Welcome to another episode of You Learn, You Turn. Today, I'm excited to have Kevin Lynch with us today. He is quite accomplished, and his bio is about, we could write a book on him. And maybe there is a book about you, Kevin. I don't know. But welcome to the show.
Thanks so much for having me. It's a pleasure to be here, Liz.
All right. Now, I don't want to make you brag, so I'm going to read a little bit of his bio just so the audience can be acquainted with who he is. Kevin embodies the Quell Foundation mission. Founded in December 2015 in North Falmouth, Massachusetts, Kevin launched the Quell Foundation, which aims to reduce the number of suicides, drug overdoses, and incarceration of people living with a mental illness. Kevin works tirelessly and without compensation to remove the stigma and normalize the conversation of mental health. In doing so, he encourages others to share their stories and creates an environment for them to do so without fear or judgment. Leading by example, Kevin openly discusses his personal experiences with mental illness, often in some of the most public forums, including commencement addresses, corporate speaking engagements, and over 100 college campuses across the United States. I promise I'll stop here. Kevin's career as a public servant began as a 12-year veteran of the elite United States Naval Submarine Force. When an unfortunate injury ended his military career, Kevin chose the healthcare sector to continue his commitment of caring for and fighting for others in their time of need. And the Quell Foundation strives to reduce the number of suicides, overdoses, and incarceration of people with mental health illnesses. They accomplish this by encouraging people to share their stories, increasing access to mental health services, providing a pipeline of future mental health care professionals with scholarships, and training first responders to recognize mental health crisis warnings amongst their own. Just wow. I don't know when you sleep. I don't know when you eat. You have been so busy in your lifetime. What brought you to start the Quell Foundation? If you don't mind going back a little bit and give us a little bit of your personal history.
Sure, of course. It's the Reader's Digest version. I try and find one. When I was in the hospital position, I had applied for a big job. I was looking to vice president of operations of a hospital, and unfortunately, I didn't have a degree. I was 45 years old. I had no degree because I had done the military. Then I went right into work into the hospital sector. So 45, I went and did my undergrad. And then I knew I needed to get a master's as well. Well, I have a son, Nick, who at 17 and a half years old, unmedicated, got into a lot of trouble with the law and ended up being sentenced to 8 years in prison, a men's max prison at 17 and a half. He spent the first 6 years in isolation, a total of 6 years in isolation. When he was released, I left my job in healthcare, relocated up to Massachusetts, bought a small house. We have a house up here in Mass, but I moved out of the house with my wife and bought a small house, and I moved in with Nicholas to help him reintegrate. And I told him he had to go to college. Nick had a 1430 on his SAT, super smart kid. But he said, Dad, I'm 26. I'm way too old to go to college. I'm like, well, I'm 49. I'll go do my master's. You do your undergrad. We'll do it together. So when he was released, I couldn't find a doctor to see him, even though I had been promised an appointment. The doctor kind of had to defer to one of his therapists. Well, this person wasn't really experienced enough to be working with the acuity of somebody like Nick, who had just spent 8 years in prison, has bipolar, and then several other conditions now as a result of being incarcerated. Nicholas ended up overdosing on heroin, self-medicating. He didn't die, but he went back to prison. And I ended up calling a suicide hotline.
He went back to prison because of the overdose?
Because of the overdose. Yeah, because he violated the terms of his probation. And it was just couldn't find a doc that could prescribe the meds. And anybody in healthcare knows you get somebody coming into an ER saying, hey, this is the med I need, how much and how often. You're a drug seeker. So after the second time him showing up at the ER for his meds, they told him, don't come back. So he didn't. He, like is often the case in the absence of treatment, self-medicate, alcohol or drugs, and or other ways. That's what happened with Nick. He ended up overdosing. I did go on and do my degree because now it was less about me doing the master's with him, and there's more about learning what just happened with Nick. How did I fail him again? How did he end up back in prison? So every paper that I wrote on mental health in America. I was just studying where are we failing this population of people, and that was my capstone paper. So when I finished, I talked to my wife and said, "Just give me two." I got offered a big job. I actually got offered the chief operating officer of a hospital, and I talked to Karen and said, "I just need 2 years. Let me see if I can make a difference or be a voice for people who often don't have anybody advocating for them." So that's when I started the Quell Foundation. And Quell, quite honestly, I found the name on the back of a bottle of wine.
No way. And what
And
does quell mean?
Quell means to bring order and balance to chaos. So whether you're somebody with a mental health challenge or substance use misuse, or the caretaker of one, all you're always trying to do is find that balance to chaos. And that's what we're doing. We've been doing this now. We just passed 7 years.
So tell me, what do you do? I mean, what does the Quell Foundation do? And I know it gives scholarships, but tell us a little more.
No, the scholarships was the very first thing. My wife and I paid for all the scholarships the first year because we still didn't even have a name, but we wanted to start helping kids, young adults. So we have 3 different types of scholarships. It's our fighter scholarship is for young adults with a diagnosed mental health condition that are currently in treatment. And then students, our survivor scholarship recipients are students who lost a parent or a sibling to suicide. My wife lost her mom when she was 12 years old. So Karen pays for all of those scholarships. And then to bridge the gap, we have this Bridge the Gap scholarship because there's not enough people in this space. So that there's just not, it takes so long. I don't know if the average is still 28 to 42 days to get a new appointment, but that's the reason Nicholas ended up back in prison, because I couldn't find somebody to help him. So we give scholarships to students studying to be the next generation of mental health care providers.
So you're creating the army that you needed when your son was going through this.
That's exactly what we're doing. I just feel very strongly is that, I mean, when we're organizations like ours, you and I both, when we're successful in normalizing this conversation, if we don't have somewhere for them to turn, we've done a disservice, because now they're aware of it, but they can't do anything with it.
Exactly.
So, yeah, it's super important to us that we have agreements with universities across the country to help us with this. University of Washington out in Seattle. We funded a program out there to teach psychiatrists how to deliver population health instead of just one-on-one, so we could get to more people. We're developing a curriculum down in South Florida at a university to train folks that are coming into this space and to be behavioral health specialists, how to work specifically with first responders. So we're trying to, where are the stopgaps? Where are the bottlenecks in all these conversations? Why do we have continuing higher rates of suicide annually, overdose rates annually? Is it because there's not enough people? And we want to address that. So we just passed $3.2 million last year, and we'll give away another 300,000 or 400,000 this year.
So it's a big education. It pays for a lot of people to get educated and be the next workforce for the mental health. So my daughter and many 20-something age group, we can't find a psychiatrist to get into, much less one that will meet with them more than 10 to 15 minutes to reissue the meds. I mean, this is the problem, because they can get the meds online in a Zoom, but then they don't know what else is going on. They don't know enough about what's going on mentally with them. They don't know enough. Their cognitive behavioral therapy, would you say that works? I don't know.
I don't know. I've not personally experienced it, so I don't know. I think there's different things that work for different people. We know that some people really thrive with EMDR, and other ones think it's the most ridiculous thing in the world. But there
Yeah.
are different, like CBT is certainly very successful in a lot of instances, but some people don't respond to it. That's all.
I guess what I'm thinking is, or I'm saying out loud, and I'm not making a whole lot of sense, is that we need more psychiatrists than therapists, because people that can prescribe, do you feel like that understand more about the mental, the brain, the makeup of it, the medical side of it?
Well, that's something that I was really addressing about 3 or 4 years ago. I thought that if we could get more psychiatrists into this space, we could help more people. So I had interns that just did a phenomenal job researching the best programs, MD, psychiatry MD programs across the country. We
Yeah.
narrowed it down to several universities. We interviewed them and finally got with the chief medical officer at the university, who said, we don't need more psychiatrists right now because what I want to do is have more residents. How do we? I wanted to pay for the residency for more students so they could come into this space. And what he educated me on, it makes sense. So it's a catch-22, is that if you have more residents, then your psychiatrists have to supervise those residents. And if they're supervising residents, they're not seeing patients.
So
And
it
if they're not
creates.
seeing patients, right?
Yeah.
Yeah, it's very, very circuitous. But something I also learned that it's upsetting is that on average, and these numbers are about 2 or 3 months old. I would imagine they're pretty similar. 68 to 75% of young adults who graduate with a degree from behavioral health program never go on to see patients because there are not enough supervisors to give them the clinical hours. So 75% of them never actually see patients. And when I think, oh my gosh, I've given away probably 1.6 to 1.7 million dollars to students to be the next generation of caregivers, and they're not actually seeing, potentially not seeing patients because there's this additional barrier. Well, now we have to address that.
I wonder if there's too much that they have to do to become a therapist. Maybe if they cut that in half, they're talking about doing it in the medical field, making it less time. And I mean, not that you want them to have less knowledge, but how many hours of supervision do you need? I don't know. Maybe that could be a way to address it. Well, how do people find you, get involved with the Quell Foundation, or ask you for help?
Yeah, so we have a great website. Our website, thequellfoundation.org, is an organization down in Philadelphia that has designed, built, and hosted that website for us since day one. They've never charged us a single penny. I mean, it's millions of dollars worth of service they've just done for us.
Wow.
So we're on the internet that way. We're certainly all over social media. We have my team now. I have 5 employees that work for the foundation. Never thought that would come. That I'm now providing medical benefits for folks.
Wow.
But and we're right now, actually Friday, we start our scholarship application period. Which is a really difficult time for us. More specifically myself, because I'm the only one who reads the applications. I didn't want to subject my team to that, but now that I have a couple of more seasoned folks on the team, I'll share that with them. But to read the traumatic stories of these folks who are writing essays, why they deserve, why should we give them a scholarship if they're a survivor or if they're a fighter? We never ask diagnoses. It's none of our business. We do require attestation, from their caregiver, but they always share the stories, and they're terrible. It's just really, really difficult. I often pick up the phone and call them, make sure they're okay, because that's how upsetting their essays are. But that's
Wow.
just the world that they live in.
Yeah. Do you think, this is just a question I ask a lot of guests, that the mental health crisis, and I call it a crisis because of what we're seeing, the suicides, do you think it's worse now, or do you think that we're just talking about it more and paying attention?
Oh, I love that point of view, and I think you could be. I think you're spot on with that one, because there's a generation. I personally feel, and I've spent a fair amount of time on college campuses over the last 5 or 6 years. This generation will tell you what they're thinking. There's no shame in it. They're going to tell you if they have a mental health diagnosis. They're going to talk to you about their clinicians. My team on my calendar right now, I know when every one of their therapy appointments is because they put it up there. And
Love
they
it.
might interject in any conversation with, hey, you know what my doctor said we should think about doing? And I love the fact that there's no pregnant pause. I can't say that would have been the case 10 years ago. They probably would have never even shared it. But I think that I think it very well could be. We'd have to research, and right now it's just speculation. But we're seeing an uptick in suicides and overdoses. But they all have to go through a coroner's office. I mean, they all have to be classified. Their cause of death always have to be classified. So I wonder if it's more people are comfortable saying this was a suicide or not accidental injury, which is what we see, unintentional injuries. We see that all the time. I mean, that's what drug overdoses fall under. But we also know that many, and I couldn't possibly quantify it, but many overdoses are suicide attempts, successful suicide attempts.
Right.
Yeah. So, and we don't know that. Oh, it was an accident.
Right.
Yeah. So, yeah, I think we're talking about it more. So we're seeing much greater numbers. The fact that we're talking about it to our first responder community, to our frontline healthcare medical professionals are talking about it. I've spoken at in a lot of venues, and coming up, I certainly am too. I can't imagine even 5 years ago being a guest speaker at the Fraternal Order of Police National Convention. You're going to talk about mental health.
Yeah.
Yeah, it's important. Yeah, so I love that. But I also think what we're seeing, Liz, is I call it a changing of the guard. Maybe folks that are my age that are on their way into retirement, the ones that we grew up, just like in the military, rub some dirt on it, walk it off, you'll be fine. I went through it, you'll go through it, nobody dies. But that's not true. So I think that this next generation of leaders coming in, it's kind of straddling the fence between the old way and the new way. And right behind them is young adults that are pushing them to be cognizant of mental health stressors in the workplace, certainly, and on college campuses. So I think we're seeing a paradigm shift right now.
I think what you're doing at the Quell Foundation is incredible, because you're not only helping the mental health crisis right now, but you're raising up a generation that's going to help in the future. And I think that is key. That is the way to stop a crisis, is to kind of go backwards and reinvent the wheel. And I think you're doing that. And I just want to thank you so much for your time. Is there anything else you'd like to share with the audience about you personally or the foundation, your son? And
yeah, well, certainly, my son's doing really well now. He did go back and do another 4 years. He was released in 2017, moved down to South Florida. He's been living with my wife and I down there for the last, probably the last 6 or 7 months. He's doing really, really well. We're very, very proud of him. So he did come out the other side of that. Right now, he's aware of the challenges that he has, but he's a phenomenal uncle to his 5-year-old nephew, who thinks the sun just rises and sets with Uncle Nick. But I think the work that we're doing at the foundation, I love what we get to do. I really, really enjoy. I work harder now than I probably worked in my entire life, because it just seems just so meaningful, that it's really impacting people, that students call me or send me emails, or their parents. When we give scholarships out, we call every one of the students. And when you hear a young lady or a young man say, "Can I put you on speaker so you can say that again so my mom and dad can hear?"
yeah.
It's powerful. And they're telling me that. I know why they're telling me that, because I read their essay. Because mom and dad didn't think there's really any, thought they were just being dramatic. They're not being dramatic. So we get to do that. I love that. We're developing our third documentary. We have 2 documentaries.
Tell us about the names of the first 2.
So the first one is called Portraits of Life with Mental Illness. And it seems like everything comes around this scholarship program. So as I was reading application after application, essay after essay, thinking these poor kids, think they're the only ones. They think they're the only ones who lost a mom or dad to suicide, or they have a brother who overdosed. They think they're the only ones. So, and society in general, for the longest time, thought they could put a finger on what mental health looks like. Oh, it's the incarcerated, the homeless, the hospitalized or institutionalized. But that's not the case. It's the people we work with. You know, it's our professors, it's our spouses. So I wanted to put a face to it that was incongruent with what society thought it looked like. And it wasn't enough to just make the film, because I have absolutely zero right making documentaries. I didn't know jack about documentaries, but I muddled my way through it with a lot of help from some dear friends. But I work with two epidemiologists. What did this film do? Fine, I feel great that we did a film, but what did it actually do? So for the first 2 years, every time we showed it, we did de-identified surveys, pre and post surveys. So I knew kind of what you thought about mental health in general. And then after the film, sometime in the next few days, you respond to the same questionnaire survey. And we were able to statistically significant changes in way people actually thought about mental health, to the point where they're saying, I am going to go reach out and ask for help. I think I'm going to change my major. So it was really good. It got our research. It's huge. So, and the research got peer reviewed and published in June of 22. So I was really jazzed about that. But when you get a student saying, I think this is what I want to do with my life now, I think I'm going to change my major. When we show the film, and I'm in the film, as I had mentioned to you prior to us hopping on, when my son got rearrested, I called the suicide hotline because I really could not see the value in waiting for tomorrow. And I have a magnificent life. I really have a wonderful life. But at that moment, none of it made any difference. All I knew is that the driveway I was standing in, the house that I bought for my son to work on, and I moved in with him, that he would never be back to that house again. It was 103 days, and I knew that he would never step foot in that house again. And it really, really destroyed me. But, you know, as we had mentioned early in the program, being a veteran, I was able to get help that I needed immediately. So that was much easier for me as a vet than somebody else. And, you know, fortunately, you know, after 6 months, a year or so working with somebody, I was able to come out the other side of that. But I was also in school, so my brain was always busy doing something.
Yeah.
So the documentary we've been showing it all over the place. Now we're trying to license it to colleges across the country so that they can have it.
Right.
Yeah, we've done the research. I did what I wanted to do with it. People have seen it. It always stimulates conversation. We always have a panel discussion at the end of it, so we can have the interaction. And the panelists are usually being 75 to 80% of the time, somebody that's in the documentary. It's always at least one or two of them.
So where can I see it? Where can we see it?
I will send you a link. It's not. I don't know how.
Netflix, Amazon.
Yeah, I don't know how to get to these people. You know, I've tried and tried and tried to get it out there, but the content also it's not incredibly palatable. I mean, not all of it, because we talk about stuff that makes society uncomfortable. There's a scene in it. I don't want to say scene. There's a conversation between a mom and her trans son about developing a suicide plan together. And if you're a parent, that's horrifying.
Yeah.
You know, they're sitting on a park bench, you know, talking about, okay, first you're going to try this, then you're going to try this, and if that doesn't work, then you're going to take your life. And you promise not to.
Someone else has had that exact same conversation, and that's going to help someone somewhere. And, you know, we need to be uncomfortable, I feel like, Kevin, and it's the only way to wake us up.
I think you might be. I think you're right. And, you know, I've been asked to remove that many times, and I won't, because I often hear after somebody has left us, who died by suicide, their loved one saying, I wish he or she why didn't they just talk to me? Okay, well, talking to you looks like this. How does that make you feel? Because you can't the reason that Dennis is alive today is because his mom sat on that bench and said, let's talk about this. Yep. And it was a gutsy move. So I'll send you a copy to it. I'm in it. There's some executives that are in it that society would never in a million years think that, you know, they had any history. Yeah,
Yeah.
it's so good. And this other one that we did, now that I did the research, I could prove that it worked. I had evidence that it worked. So I worked on first responders, because first responders have the sixth highest rate of suicide by
Yeah.
profession. More die at their own hand than in the line of duty. And several of my dear friends are first responders from my military days. Um, so I did a documentary, First Responders Sound the Alarm, and we showed it up in Chicago. We've shown it around the country. We're doing the same type of survey, but we're not doing pre because they won't do it for starters. I'm not one of them, so I always have to have first responders with me
Right.
um, to validate me. They have to qualify me in that room full of them because otherwise, like, who is this Jamoke?
Right.
So, but we've shown it a number of times, and we're doing post screening surveys, and I'm asking the questions that I need to know. I wanted to know whether or not, as a result of having seen the film, are you more likely to talk to your partner? Are you more likely to talk to your spouse about how about a clinician? Are you more likely to reach out and ask for help? Um, Statistically, yes, in that Likert scale, it's usually somewhere between 24 and 28% that's positive. I didn't have a number less than 75%. So,
Golly.
and when I asked questions. One of the questions was, have you or someone you known ever contemplated suicide? It was in the 90th percentile. Nine out of 10 of these first responders had contemplated suicide or knew somebody who did. These are people that are sacrificing their own mental wellness to protect ours.
Mhm.
Yeah. So, and then one of my final questions was, which I think is one of the most important, is, would you willingly work with somebody with a mental health diagnosis? And it was in the high 80th percentile said, likely, very likely. I
That's
absolutely,
wonderful. That's
right?
unexpected to me. But that's wonderful. Gosh. Yeah.
It's really unexpected. So what they're saying, and
Anyway, whether they want to or not.
they are. That's exactly right. One of the things that when we also do panel discussions, and it's other first responders talking to first responders. In this documentary is Chris Fields, Oklahoma City bombing, where
Oh,
Chris
wow.
carrying the bait. Chris is just a phenomenal guy, and he and his wife are both in it. They talk about the strain on their marriage, the infidelity, the divorce, the suicide attempt, everything that comes with being a first responder that's been in a traumatic incident like that. But that's just something that was nationally known. But the reality is, the worst day of our life is their Tuesday.
Yeah,
We see the same stuff
exactly.
all the time. So I'm fortunate. But what I heard, one of the gentlemen asked the question. He said, of all the first responders in this room, there's probably 200 or 300 of them. How many of you would stay back and talk to somebody if they said they needed help? If you had a colleague that said, I'm struggling with what just happened or what happened last week, would you want to hang back and just shoot the breeze? Said show of hands. And like 99% of the people put their hand in the air. And he called out the two people that didn't. And then he did. He called them out to their face. And
Oh
then
my.
he asked the same question, and he said, how many of you, if you were struggling, dealing with some of the trauma that you've experienced in the last couple of weeks or so, how many of you would talk to your partner and ask them to stay back so you could talk about it? And not a single hand went up in the air. He said, that's our problem. Every single one of you are willing to help somebody else, but you're not helping yourself. And that was a profound. I mean, you expected to see one or two hands. There
Yeah,
were no hands that went up in the air.
that is profound. My gosh.
It's profound. And we don't have people that can work with this population of people because they're not trained. You can't be more traumatized by their trauma than they are.
Exactly.
They can't
You
pick
need
their head up after sharing with you and then see you crying
you need
because,
shared experience and someone that knows what it feels. So first responders helping first responders. Do you not agree?
oh, absolutely.
Yeah.
They know what the world looks like through each other's eyes. That's
Right.
exactly right. And what this gentleman said, his name is Chris Scallon, just a freaking brilliant guy. Chris said to them, because he's one of them, he was fire service, he was law enforcement. He was military. He's been involved in a lot of stuff.
Hmm.
And he also said, oh, dear God, it just left my head. That's terrible. Oh, we always ask each other, how you doing? Good. How you doing? Good. And then we walk away.
Right.
He said, you know, we're now being trained to ask a second. No, really, how are you? No, really, I'm good. I said, here's your third question. Tell me 3 good things that are happening in your life right now.
I love
And
that. Okay.
right, because you don't let him off the hook with, yeah, I'm fine. Okay, well, tell me 3 good things, and you inevitably will get to something, a challenge that they're experiencing.
So when they say, the psychology behind that is when they try to find, if there is something going on, which most times there is, trying to find 3 things that are positive are difficult. Therefore, they'll admit
Yeah,
that
yeah,
is good. And I have never heard that before, because I even feel like with my spouse, did you have a good day? Clearly not. Yep. So, do you have a great day? Had a great day. So, you ready
right.
for dinner? No. So, I can say, okay, well, tell me 3 things that happened good to you today. You might chop my head off, but at the same time, I might be able to get into. So, yeah, that's good. That's good.
Yeah. And you know what else is another valuable lesson? I love listening to other folks talk because we learn so much from them. Another thing that Chris shares, we just showed the documentary over at Accenture, their New York office, with a bunch of their colleagues. And the way he addressed working with a mental health professional was, listen, you're not going to get the first one every single time. Said, but don't quit. You don't give up just because the person that you were working with or you sat across the table from the first time didn't work. Say, because if you had a broken pipe in your house and you called a plumber and the plumber came out and he didn't fix it, you aren't going to just say, screw it, let the pipe leak. You're going to call another plumber. You're going to keep calling until you get the problem fixed. Said, so that's what we have to do when we're looking for somebody to help us with our, with mental wellness.
Yeah,
I thought great advice.
that is wonderful advice.
Yeah.
Man, I've learned a lot today, Kevin. I'd love to have you back, and I really want you to meet Rich and Erin Crawl. You meet so many people, but she works with us now, and she actually sat with you at a conference a couple of years ago. Her father was a first responder. He's no
Oh,
longer with us, but so she works directly with first responders for U-Turn Health. And she reached out to me and said, I see you're having Kevin on. He's great. And she actually met your wife and everything else. So you'll have to come back and see us. We're
I,
quite a little family over here. And we are doing, we're all trying to do the same thing. So I think it's great
yeah,
that we can find ways to either work together or just communicate and just help each other out, build each other up. We can't change the world by ourselves. So anyway, I'm thrilled to meet you,
yeah.
Kevin. And is there anything else you'd like to share before we hang up?
No, I'm very grateful for your time. Thank you so much for this. It's
Oh my God,
to
thank you for
piggyback on your point, many hands make light work,
that's
right?
right.
So collectively we can do something about this and normalize the conversation and hopefully reduce suicides and overdoses. That's what the goal is here. So,
And there is no family untouched by this. So
true
anyway,
statement.
well, thank you, Kevin Lynch, and we'll be in touch. And everybody come back next week for another episode of You Learn, You Turn.